Lens pathology. The lens is an elastic, avascular, transparent, highly refractile, biconvex disc. The posterior surface is more convex than the anterior surface. The lens thickness at birth ranged from 3.5 to 4 millimeters, while in the elderly, 4.5 to 5 millimeters. The equatorial diameter at birth is 6 to 6.5 millimeter, and in the elderly, 9 to 9.5 millimeters.
Location. The lens is located in the posterior chamber. The posterior surface of the lens rests in the patellar fossa of the anterior vitreous surface. Berger space is a potential space within the patellar fossa. Hyaloidocapsular ligament is a circular thickening of the vitreous surface, 8 to 9 millimeters in diameter at the edge of the fossa. Vitreous body firmly adheres to the lens in children.
Microscopic anatomy. The lens capsule. This is a highly elastic capsule that is thick anteriorly 12 to 21 micrometers and thin posteriorly 2 to 9 micrometers. It is secreted by anterior subcapsular epithelium and composed of type 4 collagen, heparin sulfate, laminin, which is a glycoprotein adhesion protein combined with a polysaccharide. The function of the lens capsule is accommodation. It is a semi-permeable membrane that allows exchange of nutrients as well as protects the lens fibers from the aqueous enzymes. The subcapsular epithelium lies under the anterior capsule to the equator. The lens capsule constitutes its basement membrane. Number of nucleated cells in the lens remains relatively constant, 2,100 to 2,300 cells. The subcapsular epithelium is cubical anteriorly and becomes columnar, then pyramidal at equator. The anterior cells secrete the capsule, whereas the equatorial cells secrete the lens fibers and actively divide. Lens fibers. The lens fibers are secreted by equatorial cells, which become elongated and compacted towards the center of the lens. Lens fibers are formed of the following parts: cortex, which is the soft peripheral part, and nucleus, which is the harder central part, condensed sclerosed fibers. The nucleus is divided into embryonic nucleus, formed at 1 to 3 months of intrauterine life, fetal nucleus, formed at 3 to 8 months of intrauterine life, infantile nucleus, present up to puberty, and adult nucleus, formed after puberty. The sutures are the sites of articulation of lens fibers: anterior erect Y suture and posterior inverted Y suture. Suspensory ligaments, zonular fibers. They extend from ciliary body to equator of the lens. They are secreted by ciliary body epithelium. Fibrils are composed of a glycoprotein, mainly fibrillin, which is a major component of elastic microfibrils throughout the body. The average diameter is 270 micrometers. The zonular fibers assist in accommodation.